That's fine.
Brilliant. Okay, that's good. So yes, welcome again, everyone. So I'd like to introduce our team. We have Ruth Ball, which is our Administrator of Public Advisors, Selena Wallace, our Public Involvement Manager, myself, Public Involvement Research Lead, and our Public Advisor, Nahid Tahir, which is the lead for the Seldom Heard Forum. So welcome, everyone. Second slide. So to just give you an overview of our agenda today, so we're going to have a brief introduction. We have a variety of speakers that will be talking to us about some of the work that they do with people with neurodiversity. And also we have our public members who will be sharing their own lived experiences. And we also have some lived experience shared by young people. So it should be an interesting agenda. And then finally, we have the panel discussion at the end. So please do, if you have any questions, please do either use the chat function or raise your hand in order for us to be able to answer some of the questions. So before we go into our session today, some housekeeping rules. Just want to remind everyone to stay on mute during the presentation. This meeting will be recorded and the speaker will be pinned on the screen in order for you to be able to see them. If you feel uncomfortable having yourself visible, so you can turn off your video. Also, again, a reminder to please use the chat function for any questions. We will have ourselves making sure that we're monitoring that. And also, if our speakers would also like to answer some questions on the chat function, that would be also really useful. There has been cases of Zoom meetings or online meetings that have been hijacked. We don't anticipate this to happen, but if this was to happen, then we will have to shut down the meeting immediately, and we apologize in advance for that. And if anyone's on Twitter, please use the Twitter and tweet about the Seldom Heard Forum, and our ARC Northwest Coast tweet account is there. So without further ado, speak about what is about ARC Northwest Coast. So ARC Northwest Coast brings together health and social care providers, NHS commissioners, local authorities, universities and public advisors, and the Innovation Agency. And the idea of us coming together is to support the development and delivery and implementation of research and practice to enable a positive change for patients and public. And most importantly, having an overarching focus on reducing health inequalities. So to give you an idea of our vision was created with and co-produced with the public advisors. And the vision is to improve health equity and applied health research through the voice of the population. And you can see from the map here that we have our public members represented across the Northwest Coast. And we want to ensure that the voices of the population is heard across. And this is why we came about with this Seldom Heard Forum, because it's so important for us to empower those voices and have a wide representation of people. So what is seldom heard groups? These refer to underrepresented individuals who potentially use healthcare services and are less likely to be heard by professionals or health service research and in decision making. Often the seldom heard groups face multiple barriers affecting their engagement with health and social care services and inclusion in health research. So this barriers actually start off from organizational level, where the process itself to reach and engage with such groups is perceived challenging, and the idea of it being perceived challenging is because of the lack of understanding and awareness about the group's needs. So what does the Seldom Heard Forum actually aim to do is to create an environment where ideas and views reflect the issues and needs experienced by seldom heard groups can be exchanged. And the idea is to enhance understanding, awareness, and collaboration. So about bringing representatives from seldom heard groups, opportunity to share experiences and discuss how best to enhance inclusion in applied health research. So this is our third session. We previously have done 2 sessions prior to that. So we focused on ethnic minorities and mental health, and we also focused on youth at risk. And please do check out our website. We have published 2 blogs that is on the website that you can read about the past sessions. Hopefully we'll be working on one for this session too. We also have the recording of the videos online as well if you have missed out and would like to catch up on some of the things that we've done. So for today's session, like I mentioned, we will be focusing on neurodiversity. So neurodiversity conditions is a lifelong condition which affects the brain and influences how people think, perceive the world, and interact with others. This includes conditions such as ADHD, autism, developmental language disorders, Down syndrome, Tourette's, and just to give an example of a few. And often it's affecting 1 in 5 people. There are many people in the UK that live with neurological conditions which has significant impact on their lives. And there's over 2% of the UK population that are disabled by the neurological condition. Approximately 850 people in in the UK care for someone with a neurological condition. And often they experience health inequalities due to many socioeconomic factors, but because of the health inequalities they experience is due to delay and misdiagnosis, education, and also access to services. Historically, research on neurodiversity has not been co-produced with community members. And this is why it's so important for us in the Seldom Heard group, is for us to make sure that our public members are interacted and are part of voicing or empowering this voice in research, health service research. So this is just a brief introduction from my side. So what I'll do is I will pass on to our first speaker, Caroline. And what I'll do is I will stop sharing in order for you to be able to start sharing your own screen. Thank you from me.
Hello, everyone. I'm Caroline Litherland. I'm from ADHD Northwest.
Caroline, you've muted yourself. Sorry.
Hi, everyone. Sorry about that. I'm Caroline Litherland from ADHD Northwest. I'm just going to talk a little bit about our organisation and what we do. We were established back in 1995, so we're not new. We've been working quite some time. And originally we were formed just to support families with ADHD. At present, we are commissioned by the CCG in East Lancashire, West Lancashire and Blackburn with Darwin. So those families in those areas are getting support from us. However, we do have some additional funding from other sources, and we cover Morecambe Bay as well. That has just started this time in March. So our organisation work alongside LCAS and we work alongside CAMD, and hopefully we can sort of provide them with support and help them with some of the difficult children that we have in our system. So our role as an organisation, we are working with families of children with ADHD or in assessment. So we will pick children up that are actually going through the assessment programme. And what we actually do as an organisation, we have a helpline so people can ring us whenever, from wherever in the Northwest. We have a website that contains all the details of what we have to offer. So anybody wants to know anything about what the organisation is doing, what support we're providing, everything is on the website. But what we do provide is sort of one-to-one outreach for families. So we'll go out and we'll visit families and look at what support they need at home and provide support where it's tailored to meet their needs. We have both an online and offline parenting course. We haven't been doing the face-to-face courses recently, obviously because of COVID. We will be looking to establish those again later on this year, but they are for the commissioned areas that we work in. We also have an online parenting course that we have been running for the last 18 months. So we've still been working with these families, even though we've been through lockdown, which has been so important. And the online course runs for 9 sessions, and we get we have up to 60 and 70 families on sometimes. It's really well looked at. We support in schools. So a lot of our families are having difficulties in school with either getting support or getting educational healthcare plans, or just giving schools some advice on strategies and best way forward, and going in and doing some observations. And we also run some training for workshops for schools or professionals. But obviously there's a charge for this because the organisation is a charity. We're commissioned by the CCG to provide it for the families, but not for other professionals. But we do provide the workshops for professionals. Just a little bit about what we pick up from families as we're going along. When we speak to parents, I'll just give you some of the idea of what parents think about having a child with ADHD. They get angry and they're frustrated with it. They get frustrated with the system because our kids with ADHD don't seem to fit in with the school system and other things. They're sad, they get annoyed. Yeah. These are the words of the families. They feel isolated and judged on their parenting. They're tired, they're exhausted. It's like Groundhog Day every day for them. So it's can be really difficult. And they feel that nobody wants to listen and they're just bad parents, top and bottom of it, which is all really negative. So you can imagine when you talk to these parents, how difficult it is for these parents to be really have a positive outcomes and positive look on what ADHD is like. More importantly, during our sessions, we do speak to our children and find out how they feel. And this to me is the real key to it all. When you ask the children with ADHD to come up with things, what they think about themselves, they say things like they're lonely, they're angry, they're not liked, nobody likes them, teachers don't like them. It's always them that they're wrong, they're picked on, they don't have any friends, so they don't have any sources, they never get invited to birthday parties, they get laughed at, they're always being told off and they feel sad. Yeah, I'm frustrated, noticed, stressed that I'm weird because I'm not like the other kids. And what you've got to really think about is that these are all negative again. So we've got little kids here that are in a really negative frame of mind about themselves. Most importantly for us is that we change this around. And part of our parenting course is to sort of raise the self-esteem, allowing parents to enable them to raise the self-esteem for these children. And quite often when we've run the courses, parents do come out a lot more positive because what we talk about is not about the behaviours, and it's mostly about understanding ADHD. And a lot of these parents don't understand. They might get a diagnosis and they might get medication, but they don't understand anything about the condition. So what impact does it have on children? They struggle with inattention. They have inability to focus. And it's not that they don't want to focus, they just can't. They struggle with it. Their hyperactivity gets in the way of things that they want to do and sit down, so they can't sit still. So they're often told off, stop fidgeting, put that down, stop tapping, stop rocking. And it's all the negative things that come behind it. A lot of our children have a poor working memory. So one day they might be able to do something really good, and then the next day they've forgotten about it, or they're sent off to do something and they can do it. And then because the following day they can't do it, they're told that, you know, they didn't listen or they didn't take it in or they wasn't trying hard enough. A lot of our kids have problems with the social skills. So friendships are really difficult. So finding good friends and being able to keep them, all this is, you know, they struggle with. And this emotional regulation. So if you think about how a child feels and they feel down about themselves and nothing works right and they're always getting told off, yeah, you can imagine why their emotional regulation is like it is. It's why they get easily triggered. And that's because usually if they're feeling down, it's a lot easier to trigger somebody that feels down. So what we look at is working with schools. We go into schools, we give schools strategies, and we talk about, yeah, the teacher doesn't like me. It's irrelevant whether the teacher likes them or not. It's how the child feels that we're in. That's what we're looking at turning around. How can we be more positive? And a lot of this work is around educating teachers and professionals in those areas And we are getting more and more of this sort of work all the time. But it is so important that we start to educate people who have to work with these families and understand the difficulties that the families have. So we're regularly contacted quite often by people outside of our working area for support. Unfortunately, we don't have the funds to provide that support outside of where we're commissioned. However, we have lots of people who ring us and want to speak to us, and we are in the process of trying to set up some parenting or online parenting course, but it's not going to be free. Parents are going to have to pay for that outside of the working area, unless we can get other areas and other CCGs to fund us to provide this service. And what we're looking at is, paediatricians can diagnose, and quite often in our areas, they will diagnose a child with ADHD, and then they will refer them into us to come on a parenting program to give them a lot of understanding around the ADHD that works quite well, because once they understand it, then they can see where the difficulties lie and see what's happening at school, and it might be sensory, because obviously ADHD is sort of a condition that doesn't come on its own quite often. We get multiple diagnoses of ADHD, autism, or we get ADHD Tourette's, or we get ADHD and it's linked with other learning difficulties. So it can be quite difficult to just diagnose ADHD and work with it. So hopefully in the future, we will be setting parenting programs up for people outside our areas, but there will be a charge for that. But everything that we have to offer is on our website, adhdnorthwest.org.uk. And if anybody has, any questions about anything that's on there, then our phone number's on there. Please contact the office. And we'll work with anybody that we can to provide any support in your area. Are there any questions that anybody want? I know there's some things been going through chat, but does anybody want to ask me any questions about what we do as an organisation and where we can provide any other area with support?
Thank you, Caroline. That's really, really good insight into what you do. There's a question that I just came across now. It says, can I ask if people with ADHD are running these courses?
People with ADHD no. The people with ADHD, but I've got Sheena who works here. I've got a son with ADHD, so I know what it's like to be a parent with a child with ADHD. Sheena who works with me, she has 3 children with ADHD. 2 of them have got ADHD and autism. So we have a good understanding. Angela, who works with us, her child is diagnosed with ADHD. So as a parent of children with ADHD, we know what families are going through. So we have a good understanding of how they feel. And my son's older now, and how it impacts when he's older, so yeah, things do change, but as they get older, how do they change and what difficulties do they have in adulthood, and where do they get support? Because we know that support for adults is very minimal.
Yeah, that's great. I think there's another question. It says, what work is being done with ADHD diagnosed in young adulthood? Is that through a different service?
Yeah, that we have now, it's just changed to what's called Haydock Medical. I'm just trying to think. They're dealing with anybody 18 plus. But we do know there is a massive waiting list for adults to be assessed. What we find is when we run the courses that we run and we talk about ADHD being genetic and hereditary, we start then getting families that start saying, well, I had difficulties with this and I had difficulties with that. And then they're saying, well, that's why the family could be dysfunctional. So they then want assessments. But unfortunately, it's not just as easy for adults. The last time I heard, the waiting list for adults was something like 18 months to be assessed. Yeah. So you know, it's quite a long way off.
Yeah, I'm just cautious of time. I'm just looking at some of the questions. There's a mention in there that maybe the terminology to use parent courses is the wrong term to use. What's your thoughts about that, Caroline?
Yes, it is a parenting course, but it's just directed to ADHD. Basically, it's around ADHD. So what we find is initially we go through the understanding of ADHD. So people have a good understanding is why do they not remember things? Why do they go upstairs to get something and then forget about it? Why do they do some of the things that we do? So once they have that understanding around ADHD, we then talk about strategies about how they communicate with the kids, how and we use a 1, 2, 3 magic program, which helps support families under 12. So there are strategies, but the biggest strategy for me is understanding the condition, understanding what they're dealing with. And then we can start putting things into place that we can support around the families.
Yeah, that's really good. And I think also there's a mention like, you know, working with families and of children who have complex needs of ADHD. I mean, how that kind of ties to what you were saying as well about understanding their needs, isn't it?
Yeah, most of our children don't come with ADHD alone. Always comorbidities usually with it, learning difficulties, dyspraxia, dyslexia, autistic spectrum, you know, there's Tourette's, tics, you know, quite often these things come along with ADHD. So it's good to, we have a good understanding across the board about other conditions because, and where to refer to, because obviously we specialise in ADHD, but we've got some good specialists out there that can deal with Tourette's and autistic spectrum.
Yeah. And I think one last question before we move on, and I think there's great questions in the chat, Caroline. If you can also look through them and answer, if you can, that'd be brilliant.
I will do, yeah.
Just look, they say, you know, what about getting support from CAMHS? You know, what's that like? Because it's mentioned like they don't like to work with neurodiverse children. What's your experience of that?
My experience of CAMHS is they are very good, but they are very restricted as well. You know, they're good, they provide a good service. They haven't got the facilities, you know, quite often our CAMHS will refer into us for parents to have an understanding around ADHD. So it frees them up to deal with the more of the medicational and the consultation and the assessment side of it. And we get CAMHS referring a number of people into us to give them space, really, so with the consultant side.
That's brilliant. So that's work, you know, with each other. That's brilliant. Thank you so much, Caroline. That's been a really interesting presentation. Again, I'm going to just remind everyone, just keep using the chat function, Caroline. There's loads of questions for you there to answer. So use that. So thank you for that. Okay. And can I move on to Selina Wallace? Thank you.
Hi, everyone. Thanks again. I'm Selina Wallace and I'm the Public Involvement Manager for ARC North West Coast. And it's been a really interesting discussion. This is an area that's very close to my heart because my son has ADHD and autism. So I'm just going to share my screen. Great. So I was just going to do I've got 2 videos to share with you, one of some children talking and also an interview that me and my son did with an adult with neurodiversity. So just really quick reflections on my own experience. I'd say diagnosis is a very long, slow and convoluted process, and it adds to inequalities around neurodiversity. I'd like to share that it was only in 2013 that doctors were able to diagnose ADHD and autism together in a child or an adult, and that prior to this you could only be diagnosed with one or the other of the conditions. I think that research is showing increasingly, as Carolyn said, that most people with neurodiversity have multiple conditions, and that also includes mental health related conditions. So my son Finn has been diagnosed first with ADHD. He has a working diagnosis of autism. He has a diagnosis of tics, anxiety, dermatillomania, which means skin picking, and DCD, which is also known as dyspraxia. So there are researchers that are talking about what they call embrace complexity, and that diagnosis should be under one umbrella. So instead of going, right, we think this child has ADHD, you have to go through the ADHD process of diagnosis, which is a long, difficult process anyway. And then if they have another condition, you have to wait and go through another whole process with another department and another one, and this can go on and on for years and years and years. And in the meanwhile, parents and children don't necessarily get the support that they need. I'd also say that getting support from other parents is really important, and actually it's other parents that often pick up on early signs of neurodiversity, maybe than professionals, and that it's other parents that have supported me in getting the kind of help, but some of the kind of help that I needed for Finn, like applying for disability living allowance and an educational healthcare plan. But it's also really hard on parents because you've got to focus on everything that's wrong with your child constantly and the difficulties that they're having, and that takes quite a toll on you and them. Just also, you quite often have to take your child to assessments and talk about them while they're there, which I find really difficult as well. Anyway, I'm going to move on to the videos because I'm going to go over time otherwise.
Neurodiversity. So diversity is like different groups of different things. Neurodiversity is like that, except with the brain. Different disorders like ADHD, autism, Asperger's.
Which ones do you have, Tom? Do you know?
I have ADHD. We have mild dyspraxia. You found out, and I think you said I had Asperger's.
It was Asperger's, now called your autistic, your autistic spectrum.
I have autism too.
Autism as well.
Well, I would say I feel like I'm treated the same. I do have I do get like extra help now and then. I struggle with getting things wrong. I think I'm like a perfectionist. I want everything to be perfect. Really.
What does it feel like if things feel like they're going wrong?
Well, it's really just panic, and like eventually I will probably get angry most likely.
Yeah. Okay.
It can be good and bad in both ways.
If you want to say something, you can always put your hand up and just say, or you can just shout out and say you've got an answer. You don't have to stay on mute. Finn, do you want to tell us what it's like for you? Do you think people treat you differently because of ADHD?
Well, I find my mum doesn't exactly, but I find school might do a little bit because why I get in trouble a lot more than other people is because of my ADHD.
What makes you get into trouble? What happens?
Sometimes someone's telling someone something when I said what I don't want them to tell the other person because maybe it's mean, and I didn't think before saying it.
Neurodiversity.
So,
Neurodiversity.
no. Next. So that was just a very short snippet of a couple of children, my son and his friend Tom, that were sharing how the experience of having ADHD and autism is for them. And next I'm going to show you a video of a rapper called UK Craigie, who's a local Northwest Coast rapper who has neurodiversity.
Thank you very much for having me. It is really appreciated. I am a 31-year-old hip-hop artist who has neurodiverse itty, I suppose that's what we call it. I suffer with dyspraxia. I'm a little autistic, and yeah, I'm Craig, also known as UK Craigie. I make heartfelt, emotional, passionate hip-hop over acoustic guitar, and I'm thrilled to be here with you. Thank you very much for having me.
Oh, thanks, Craig. And you live on the northwest, don't you? Whereabouts?
Yes, originally from Oldham, just outside of Manchester, and I moved to New Brighton on the Wirral 4 years ago, last February.
We were going to say, how has it affected you growing up?
Okay, so it was a massive struggle, simply because when I was younger, nobody really knew what was going on. We knew that my handwriting was bad. We knew that I struggled with balance. We knew that I was very bad at things like PE. My hand-eye coordination, my motor skills were really pretty much non-existent. And it was only when I had a teacher who was, because I had like handwriting classes and all sorts when I was like 7, 8, 9 years old, because they were just trying to, they thought I was lazy for a long period of time. Like everybody, my teachers, my family, like everyone just thought I was acting up and I was misbehaving and I was, no real motivation, and I was just lazy and putting it on. And then I got diagnosed with dyspraxia when I was in high school. But up until that point, it was very much like school wasn't somewhere that I liked to be. Home life was a bit tricky. We grew up without a dad, just my mum and my brother. So home life was a bit challenging. And then at school, I was just treated like a little bit of a failure, really. Somebody who just didn't apply himself. But it wasn't the case. I had to try twice as hard as the other kids just to make half as much progress, and it was really disheartening. It was only when I'd grown up and like now I've kind of I understand myself and I've looked into it, and my daughter is also neurodiverse. It's only all of those things happening that make me confident in being who I am. That's why my music takes such an emphasis on helping people and being there, because I know what it's like when you feel like you're alone and people around you just think that you're not worth anything, really.
That must have been really frustrating. And
yeah.
Did you want to ask how it affects his music?
How does it affect your music?
Not so much now. I think now it just gives me an awareness of, like, I'm very conscious of people. I'm very conscious of what people need. So some people might need that little bit of encouragement. I always say, Finn, like, I make music for people like us, people who are overlooked, people who are underdogs. When I first started, I was dreadful. I had no sense of rhythm, so it took me like 2 or 3 years just to get that down. Like, I'd listen to music and I'd try and piece the words to it, and it just wouldn't. It was like a jigsaw that I couldn't figure out. So it affected it massively, like, because rhythmically, like at the start, I had no rhythm at all. So it feels like we have to try twice as 3 times, 4 times as hard. But I think along with that, you get a positive, you gain so much resilience. Like, I don't feel like if I was the way that I am and I tried to do something and I sucked at it, I don't think if I was neurodiverse that I would have stuck with it. So I'd have tried music and I'd have thought, this really isn't for me. So I'm done, I'm going to go do something else. But because I was so passionate about it, like, I don't know if it's the same for you, Finn, but if I like something, I get dead obsessive. Like, I become in love with something. So I don't just rap, I'm in love with it, and I listen to music all day, I listen to beats all day, and I rap all day, and I write all day. I just become obsessed, and it's the same with anything. So yeah, it's something that had to be learned. I'm glad that I am the way I am, that I am neurodiverse, though, because I feel like it's definitely helped.
So would you say that there's any sort of other positives about it? What would you miss if we took your neurodiversity away from?
Just the fact that I really don't care what people think of me. Like, I could not care less. If I walked down the street and 5 people laughed at me and said, well, he looks silly and he's daft and he's... Like, I don't care. I feel like because I'm neurodiverse and because obviously I've had that from a young age, being at school, he can't tie his shoelaces, he runs funny, he can't balance right, he does this and he does that. And after a point, you just almost become bulletproof. And I think that's such a necessary skill. And I think that's why people seek people who are neurodiverse, say for jobs, say for all sorts of things. It's because we are so resilient. So I think that's one of the biggest positives, really.
Do you think there's more support for kids and stuff who are neurodiverse now than maybe when you were growing up?
Absolutely. I was doing an interview with somebody a few weeks ago who asked me this, and it's amazing. Like, obviously my daughter, she's got ADHD, she's got autism, she's dyslexic, and seeing how different it is now. I mean, she's 6 years old and already we've got everything being put into place. And fair enough, I've had to fight for it for a little while and it has been a little bit of a struggle, and I do feel like we have to jump through hoops. But in terms of when I was a child and how alone I felt and how depressed and misunderstood I felt, because I didn't really even get a diagnosis till I was like way past the point of being helped in school, really. So to see that it's picked up and it's pushed along and she's got the help, she's got the assistant teachers, she's got everything that she needs in place, it's so nice to see. It really is. It's like it's a whole different ball game these days. I couldn't believe how much support there was.
Yeah. Do you rap about your neurodiversity at all?
See, it's funny, really. I never used to that much. I dropped my first album the year before last called Somber, and it was never that much of a fixture. And then I started to do more for these kind of things. So like I've done interviews with like dyspraxia. There's a podcast called The Two Dyspraxics. They've had me on there. I've done loads for like dyspraxia charities. I'm like, I fully take on board now that I am like an ambassador of those kind of things. So that's something that I'm really looking to put more into my music. It's always there, and there's always like undertones of like the underdog, and there's always undertones of the dyspraxia, and there's always undertones of like feeling alone. But that's something I want to push further. As we
do you fancy giving us a little sample?
Okay. Anything that you want. Okay. I'll give you a little bit of something. Are you gonna rap with me, Finn? Do you know that one?
Yeah, I know, I'm sure.
Okay. We can't say the F word though. Okay, I'm ready. 1, 2, 3. You feel life's pressure daily, but you still try your best. Anxiety hits, you feel that pain in your chest. Bills keep piling up, you see a couple overdue. So you hide yourself away from the people who care for you. You don't want to face the world, who cares if it's nearly 4? These are your coping mechanisms because you've been here before. When nuisances don't want to end up in nooses. Today we cannot quit, given to our hopelessness. And every day we try, but we still can't cope. Got tears in our eyes, trying to provide and be the best for our family. But if this doesn't work, honestly, there's no plan B. The feelings of being unsure, because that's something that still massively grips me. Like, even though I've overcome a lot of the things that affected me as a kid, like the whole vulnerability and feeling like the weight of the world's on your shoulders, like you've got a noose around your neck sometimes, and you just have like these moments of mass anxiousness. That's something that I do still struggle with from time to time.
If there was anything you'd want people to take away from understanding about neurodiversity and dyspraxia, what would it be?
Patience and kindness. I think that a lot of people express frustration when you aren't able to do something maybe to the level that is normal, and the people really do get frustrated. And I think especially when people are younger, it's so important to nurture them and to give them encouragement rather than to make them feel like crap. Like I think it's so important, because there's not very much somebody can say to me now that would upset me. Like at this point in my life, I'm like I've said to you, you build up a resistance and you build up a resilience. So I'm pretty much bulletproof. People could say anything. But I think back to 9-year-old me, 10-year-old me, 11-year-old me, and I think kindness goes and empathy go a long way, more than anything else. So just to be kind, really.
I have one more thing to say.
Oh, you got another thing to say? Okay.
Yes.
Guys, maybe after this, if you liked what you're hearing about everything, then maybe go check out UK Craigie's music.
Very good.
And it's very good. Just try.
You're very good. You've got a future in music management, my friend. That was ice cold. I love that. That was very good. Thank you very much. But yeah,
have a great night.
Thank you very much. But yeah, it's available. Just to carry on from what Finn said, Spotify, iTunes, everywhere. I hate saying this because it makes me sound dead pretentious, but if you Google me, then it'll all come up. So thank you very much. Cheers for having me, guys. I really appreciate it.
Thanks, honey. Take care.
See you later. Bye-bye, guys.
Bye. Brilliant.
Thanks, Selena.
Thank you very much.
That's really good. Thank you so much. It's really interesting thoughts to have on both Finn and UK Craigie. So can we go to Mel, please?
Hi, yeah. Have you got my presentation to put up?
Yeah, Ruth should have them.
Just bear with me, I need to get it up. Hold on.
Yeah, I also emailed you a picture, Ruth, that if you get chance, if you could just put it up at the end.
Okay, just bear with me. I'm just going to get on to share my screen. I'm hoping that'll work. Sorry, can people see that? Because I can only see one thing on mine.
I can see it.
Can you see it?
Yep.
Yeah, you can see it.
That's great. And it should, I'll let you just move it on, Ruth, at appropriate times. It should be obvious, hopefully,
okay.
rather than saying. So, good afternoon, everybody, and good afternoon from a very sunny Preston in Lancashire. And we don't say that very often, as we're England's wettest city. But it's I'm really pleased to be with you, and I'm really pleased to see the sunshine outside. Hopefully over the next 10 minutes I'm going to give you a little bit of a flavour as to who we are and what we do as an organisation. Hopefully you'll pick up our kind of culture, and I'll talk about what we've done during the pandemic. And actually Freedom Day is a good day to say it, because it feels like we're kind of getting to the end of it, so that's good. So Disability Equality Northwest is a user-led disabled people's organisation. Now, for some people, that might be a slightly different phrase to what you're used to hearing. So we are also a company, and we are a registered charity. But the reason we call ourselves a disabled people's organisation is because the majority of our trustees, our staff, our volunteers, and all of our individual members are all people with lived experience of disability. And that's written into our governing document, and it's absolutely crucial. It's at the heart of who we are. So it's not just about us being a charity supporting local disabled people. It's about us being a group of disabled people supporting disabled people. So as I said, we are also a company and a charity, so we've got all the governance that comes with that. We were set up in 1997. In July this year, so just now in July, we've just started our 25th year, because we became independent in 97, but we were originally set up in 96. So that's really good. Hopefully later on in the year, we'll be able to celebrate with people. And we were set up to champion the rights of disabled people, to improve the access and to support people to live independently and be active in their communities. So in order to do that, we deliver a range of services and activities. And I'm always really reluctant to list the services and activities that we provide, because what is more important is our strategic plan. We have a 3-year strategic plan, and we like to think we are very reactive to what disabled people need at that time. So obviously last February, when the world changed, our strategic plan, it was kind of in operation, and we've got some good services around independent living, around direct payments, supported banking, hate crime, benefits advice. But then obviously that was a 3-year strategic plan, and in last February people needed us to deal with their support needs during the pandemic, and disabled people's needs obviously changed a lot, and we reacted to that. So I'm actually really proud of the team that we've got here. I think they'll say they reacted to it because I asked them to, but I am really proud of how we changed our services from last February. What we didn't do was close our doors and say, I'm sorry, that's it, we can't do it. So what we did during lockdown is we kept all of the same services, because we knew they were important to people, but we changed how we delivered them. And then we added a great big massive wodge of welfare calls in order to make sure people were safe and well. That was our aim from last February to now, and maybe later on in the year, is to make sure people are safe and well. So we started delivering personal protective equipment to people that were on direct payments, because I think very early on there was a lot of talk in the media and a lot of support for care homes and residential, and people forgot that lots of disabled people are on direct payments and employ their own staff, and those staff needed to be kept safe, and obviously disabled people did. So we started to deliver PPE across Lancashire, and we were very lucky that we recruited another 7 volunteers to help us do that. And that was really good, because lots of people didn't want to volunteer and they didn't want to go out the house. And we had 7 people that actually said, I'm quite happy, I'll deliver it for you. And I think up to now, we've probably done about, since this was put together, we've done about 1,500 PPE deliveries. We've taken 43 new disability hate crime cases. So on a positive, crime generally in Lancashire, and particularly in Preston, went down during the pandemic, but it changed. So burglary went down, you know, assault went down, shoplifting went down, all for obvious reasons, because things were closed and people were out and about, and hate crime reports went down. So that was really good, but they only went down for a while. As soon as things started to open up again and people were out and about, we started to get more reports. So we took 43 new disability hate crime cases. We made over the year from from March 2021 through to June this year, March 20 to June 21, we made just over 33,000 welfare calls. And that was really, really difficult, we had to buy a whole new cloud-based phone system. We recruited 2 deaf project workers to support the deaf community, and we made over 33,000 calls. And the calls were literally every week us picking the phone up and saying, are you safe? Are you well? Are your family okay? Is there anything that you need? And then if they did need something, we'd try and put them in direct with that. And what happened is, as lockdowns eased and then we went back into lockdown, I think it's important to remember in Lancashire, we have probably been locked down with the local restrictions since last March. So what happened is people got very, very low. So mental health was a real biggie. And of course, domestic abuse, relationship issues, family issues. So those welfare calls were absolutely vital, because we were picking up when people weren't well. We were picking up issues of people struggling to book vaccines. We were picking up issues of people not having any food. So they were absolutely vital. For people that we couldn't get in contact with, we sent out just over 2,500 welfare letters and little cards. So we had little postcards printed just to say, just a reminder of our contact details if you want us. We did emergency funding requests. We continued to do training, because obviously some organisations were working. So we continued to do disability awareness and hate crime training, and we trained up some hate crime ambassadors, volunteers from other organisations who would spread that message around hate crime and incidents and staying safe and how to report. We took general advice calls. We also had 304 inquiries about face mask exemptions. And I say inquiries, they weren't really inquiries. There were 304 people from outside our area. So that shows that there's not a lot of support out there. From outside our area, disabled people who were being abused because they couldn't wear a mask and they were exempt from wearing a mask. Most of those obviously are people with hidden impairments, and that's been one of the hardest things actually, is listening to how people have been tracked because they're exempt. And it just felt like society was looking for somebody to blame, looking for somebody to have a go at. And what they did was picked on people they perceived to be the weakest. So we answered those inquiries and tried and got people some support later, closer to home. We've just
to let you know, we've just got 2 minutes left.
Yeah, that's fine. We did 17 information videos in BSL and some social media campaigns. We also did a piece of research with, just put the next slide up. So we did some research with local people, asking them how COVID has been for them, because obviously we need to look at future services, as does everybody. And most of people said their support was negatively affected. So you can see there on the screen what we found, but the biggest thing was people either didn't want support workers coming into the house, or support workers were testing positive. So that was really difficult. People literally became very, very isolated with just the family. And that, I think, is something that we need to look at and support people with now. So in terms of hidden impairments, in terms of neurodiversity, this is what we do all the time. But it was interesting listening to Carolyn talking about children, because we deal predominantly with adults who have never had any diagnosis, so they don't understand, you know, neurodivergent, neurodiversity. And that's fine. That's absolutely fine, because we look to the social model of disability and we don't talk about particularly impairments. We just celebrate. We celebrate things like extra chromosomes, you know, we celebrate difference, and we just ask people to come to us for help if they've got a barrier. So if they've come up against something that they need help with that they can't do, that's when they contact us. They don't have to, you know, say it's because I've got this, that, or the other, because very often they just don't know. They just don't know. So yeah, so that's a bit of a whistle stop tour. I will try and answer the questions in the chat, but I am struggling because there's so many.
Thank you very much, Mel. Yeah,
I'll be around later.
Thank you. Yeah, there are questions there in the chat. Next on the agenda is Alan Griffiths. Alan, and I will share your screen for you.
Right. Who's going to?
Okay, are you ready, Alan?
Right. This is who I am. It is narrated by me from my son, Christopher. Can we go on to there? There we are. Right. Chris was born on the 24th of August, 1983. At Arrow Park Hospital on the Wirral. This is a photo of him taken about 8 hours after his birth. It was taken in the special care baby unit. He had suffered fetal distress prior to his birth, and when this photo was taken, he'd already stopped breathing at least twice after his birth. About a week later, the consultant paediatrician, oh no, stay on the first one. About a week later, the consultant paediatrician took his mum and me to one side and said, I suppose you've been thinking about your son's future. Well, I can't promise he won't be brain damaged. I don't remember any of the rest of that conversation. Now, second one, please. Christopher, the next picture was taken when Christopher was 3.
Could everyone go on mute, please, while if you're not speaking?
This picture was taken when Chris was 3. People talk about learning disability as being the invisible disability. Well, I can see a bright, intelligent little boy. I don't know about everybody else. Sadly, a few weeks later, he was diagnosed with developmental delay and epilepsy consistent with brain damage at birth. It was recommended that he attend a special school, but of course the local authority refused that. After a fight, we got him into a school for children with moderate learning disabilities, or MLD. I joined the school governors and became chair in the first meeting. My wife fundraised and got 2 sunshine coaches for them while Christopher was there. When he was 14, he was moved to a school for kids with severe or profound and multiple learning disabilities, as it was discovered that his developmental delay was far more serious than originally thought. Again, I became chair of governors, and again, Sally raised money for another sunshine coach for them too. She enjoyed doing that. In the interim years, he was hospitalised a few times because of his epilepsy, which became unstable as he grew, which is quite normal, so I believe. When he left school at 19, it was time for transition to adult social services. but they didn't want to know him. He had a moderate learning disability as far as they were concerned, and didn't therefore warrant a service according to them. Children's Services, the Education Department, and St Helens and Knowsley NHS Trust all said they were wrong, as eventually did an independent inspector, the local government ombudsman, and it still wouldn't budge. Eventually, we went to a solicitor who was recommended to us, a very, very famous chap called Luke Clements. He's a professor at Leeds University and very well known in the field. One letter from him and the council gave him. Chris was about 21 by this time, and I'd love to know what Luke actually said to them.
Would you like the next slide, Alan?
Yeah, next picture, Christopher is a young adult here, still looking quite intelligent to me. A year earlier, so he only was about 20, his mum and I decided to join MENCAP, initially the local branch, but I became more and more involved, joining regional committee, then the National Assembly, and then in 2007 I became a trustee of what's called Royal MENCAP Society, which is the national one, where I remained till I was till 2011. During these 4 years, MENCAP launched a campaign called Death by Indifference, which told the story of 6 people who had died unnecessarily in the hands of the NHS due to its indifference. I actually met some of the parents, which was quite a traumatic experience for me. I'd never really thought about people like my son being the victims of health inequalities. In 2009, my wife was diagnosed with an incurable cancer. 2 weeks later, I was diagnosed with a pituitary tumour. And during that year, between the 3 of us, we spent an average days a week visiting hospitals. So I was forced to take early retirement, as I'm sure you can imagine. Sally, alas, died in May 2012. At first, Chris took it very well, too well, really. Then after about 3 months, I took him with me to a bereavement counselling meeting at the local hospice. After a while, he totally lost it. He went berserk, blaming me for not looking after his mum, blaming the doctors for switching off the machines, blaming God for taking his mum off him, and blaming her for leaving him, which, as you can imagine, was the hardest part. He was referred to the local mental health trust and disabilities NHS trust, which is then 5 boroughs, but they said that it was a normal reaction for people with learning disability. A few months after that, he had an appointment with his epilepsy consultant, Professor Tony Marson, who a lot of you will know as ARC's PCCC team lead. There was a repeat of Christopher's performance. And after that, Tony asked me if it was okay to refer to Chris again to 5 boroughs. And I said, yes, please. This time they said they would put him on anger management group, but after a few sessions, they told me there was no point because he was autistic. He was 29 by this time. And for the life of me, I can't understand why nobody could figure out that he was autistic before then. I can't fault what happened next. 5 boroughs were great. I went on a course or 2 about autism, the traits, and so on, pretty much all of which applied to Chris, and how challenging the behaviour of somebody with autism and a severe learning disability can be. Tell me about it. It can be. Over the years, I became a member of St Helens Learning Disability Partnership Board, a trustee and later chair of MENCAP Liverpool, as well as MENCAP St Helens. And I joined Pathways Associates, CIC, where I became and remain chair to this day. Through Pathways, I became involved in the Transforming Care programme. I'm on the Cheshire, Merseyside Ops and Strategic Boards. And this is about getting people with learning disability and or autism out of long stay hospitals and into community care, including children and young people, including secure units for no reason other than they have LD or ASC. And there are some here in the Northwest. Very quickly, I'll just say that I found out only last week, the House of Commons Health and Social Care Committee reported that, and I had a very short quote, there remain over, if this was only Winterbourne View 10-year anniversary, there remain over 2,055 people in secure institutions today where they are unable to live fulfilled lives and are too often subject to treatment that is an affront to a civilized society. That's people with learning disabilities and autism. Now, at the same time, I became involved in the LEADER programme, for which I'm Cheshire and Merseyside on the steering group. It's a national research project looking into unnecessary deaths of people with learning disabilities and why they have a lifespan which is 20 to 23 years less than everybody else. Good news, UPlan have just become involved in this and are looking for support from ARC North West Coast, which I'm really excited about. This brings me to Clark and ARC. I became involved in a project with the NHSE as a PA, which was a Clark project, not that I knew that at the time. Then there was a chance to join the Health Inequality subgroup, which I jumped to. A little later, I was invited to join with SPHR as a PA on a project looking into the HIAT, and also the Liverpool BRC bid as a PA. I love being a PA. I hope my motivation has become clear in this. I feel as if I'm doing my bit for vulnerable people such as Christopher, but not just for him, for all the people who, for whatever reason, are on the wrong side of the intersectionality that causes health inequalities. If you can just put the last slide on, just a few seconds left. Oh, finally, Chris, these are two pictures of Chris. He loves animals. The one on the left was taken at Aintree Racecourse in a parade ring. Now, if you've ever seen a bigger grin like that on anybody's face, show me. I think it's fabulous. His mum actually was quite an accomplished horsewoman. And I just wonder how different his life would have been had he not been learning disabled. The last one was taken on Kangaroo Island, near Adelaide, or just off the coast of Adelaide. That's him with an Australian wedge-tailed eagle standing on his arm. I love this picture. I've got it on the wall just up there. If you look at it, I can't stop looking. I just can't help wondering what's going through that eagle's mind as it's staring at Chris. I just think it's great. That's it. Thank you very much. Hope I didn't overrun by too much.
Thank you very much, Alan. Can we have our next guest, please? Janet Ireland, are you there?
Hello, thank you very much for inviting me.
Thank you, Janet.
It's lovely to hear everybody's stories this afternoon. I think Ruth's going to help me with my slide presentation, but don't worry too much about the slides. It's just to guide me through the talk, and I'm happy to take questions at the end as well if anybody wants to. So we are the Brain Charity, and we're based here in Liverpool, but we are a national charity and we support everybody from all around the country. So I'm on slide 1 now if you want to share the slide do the slide presentation from the beginning. And yeah, we support anybody with any neurological condition, and that's whether people know that's a neurological condition or not. We can see the slides. That's brilliant. If you just go into start slideshow from the beginning. Brilliant. And then if you just go on to the next slide, please. Yeah, lovely. So if you just stay on that one there, that's lovely. So yes, the reason why I say we're a national charity is because here in Merseyside, we've got like the 5 local boroughs that border around us, and people don't know where they're accessing services, whether they become in this service or that service. My health service might be one, my local council might be another one. With the Brain Charity, it does not matter where you live at all, and we always say it doesn't matter what colour the we live in is. We have no physical boundaries and restrictions to accessing us. We're here to support anybody with the condition and their families, carers and friends. And neurological, I say, if you could just go back to the previous slide, if possible. There are more, as we said at the beginning. Oh, there should be a slide that says, who are we? That's it. Obviously, there's thousands and thousands of neurological conditions, more than we could even imagine or list. They include ones that you know, and obviously ones that we're talking about today, which we've already mentioned, like autism, ADHD, Asperger's, dyspraxia, dyscalculia, dyslexia. The reason why I said about the colour of you really bin is when we ask people what local authority area they live in, they often don't know. So if we ask you what colour your wheelie bin is, we then know what local authority you live in and come under. And then we, and as you say, that can be a barrier to which bits of services you can access. One of the things we do here at the Brain Charity is to support people with understanding what is available to them, and also helping them to access different services, and also to reduce barriers. We're helping people to understand their conditions. If you could go on to the next slide, please. I say, don't worry too much about the slides, and if they don't match up with what I'm talking about. We're here to support anybody over 16, but actually we are now supporting a lot of families, lots of individuals, and we also have now projects for younger people. But families have children and who have a neurological condition, as we're talking about today. So we will be supporting those families. So really, how old somebody is, again, is not a barrier to coming to the Brain charity. We are supporting people really from naught right through, all the way through their adulthood. And we are helping them overcome the barriers that they face, and we're helping people to be able to reach their potential, but also we're here to empower and enable people as well. We're here about every individual is a unique individual. They don't have to explain themselves. They don't have to validate themselves. Everybody has a very valuable role to play. And with people, often they maybe come to realise a particular diagnosis only in adulthood. People find, as we've shared experiences today, that you are living in a certain way, and suddenly you get maybe diagnosed with autism, or you're going to have an assessment for a job and find, actually, I've got dyslexia, or actually that actually answers some of the questions that I've been or experiencing as I'm growing up. And I'm also supporting a lot of adults in in sort of 50s and 60s, 40s, 50s, that actually is suddenly finding a lot of answers to lots of questions they had in their life. So we're enabling people to have a voice as well, and helping them to be able to have their voice heard. If we can go on to the next slide, please. We're here to help provide practical help, emotional support, and social activities, and that's been carrying on all through the pandemic. Although we had to close the building, we've just been carrying on exactly the same, even though it's from home. People wouldn't know really where we were delivering the services. If you could go on to the next slide, please. So we're helping people understand the condition, and we're maybe helping families understand the conditions, the situations they find as their young people are perhaps diagnosed with a situation. We've heard in the news this week, I think in the Echo, there was a story about a lady whose teenage children have been diagnosed with Tourette's, and then obviously finding about the lack of services there are now for that, and she's setting up support services for parents. So we can help support with that, let people know about different support groups that there are available, because people often do not know what's out there. So we're here to help reduce those barriers and increase access to information, advice and support. And then we're supporting people as they're maybe looking at moving into that, when we've mentioned the transition, as you're moving from being a young adult into adult services, maybe moving from school into work. What's going to happen now? I've got to 18. I've left the support that there is there for young people. Suddenly, what am I going to do? How am I going to work? What different things can I look at? What can I access? So we're again here to help you through that journey, help you to find your voice, find and support you through that maze that is out there. We do all the benefits, supports is we can support everybody with welfare benefits, care and support, housing advice, but particularly advocacy. If we could go on to the next slide, please. We also have emotional support via counselling and the counselling services, a whole lot of things that we do here, befriending. And if you go on to the next slide, we've got lots of social activities that we do as well, and we're enabling people to take part in lots of different activities, social activities, come and meet people alongside. If you could go on to the next slide, please. A lot of what we do is often we have a certain number of staff, and a lot of our staff also have conditions with they have neurological conditions. A lot of conditions aren't visible, so you would come along and you wouldn't know. With a lot of our staff and our volunteers, we cannot do what we do without volunteers. We have a lot, and majority of our volunteers have a neurological condition. And again, the thing with neurological conditions is they are hidden. You cannot often see that or realise that or fully understand the complexities of a person's condition. And if Naheed doesn't mind me saying, I can point out that her daughter Amber, we support at the Brain Charity, and as I speak now, Naheed's daughter Amber is on our reception, and she's on our reception meeting and greeting people as they come into the building, welcoming them and supporting people. The other thing we're enabling people to do is enable them to have opportunities they may not otherwise have or come across, and that is one of the areas is looking at research. We get lots of research opportunities, and we have been supporting and empowering people to take part in research. And if you could go on to the next slide, a particular large piece of work that we did with Owen Barden from Hope is, these are some of the examples of research that we've done, but if you could go on to the next slide, the one with Owen Barden was looking at inside the history of learning disability, and these took part with a panel of people with different conditions, including autism, ADHD, anxiety, depression, PTSD, and Fragile X. We were able to support the people because they needed support in order to engage with the research. So they were supported by people and actually were so empowered. If I can encourage you to go on our website to have a look at the website which we hosted, which we are hosting on our website, and you can go and see, and actually the people themselves who took part in the research, all their experiences, their stories, their own words. I'm here just to express on behalf of the people that have taken part in this research, what it is that they did. All their own words are on the website, expressing it was the most empowering project. They said it is one of the most empowering things they did. And the young people, particularly the young people that were in there, they never would have gone to university. They never would have had a chance to present. They never would have had a chance to take part in research. And we've enabled them to do that. And they ended up, if you could go to the next slide, this is a picture of them preparing for their presentation at the final workshop, which is at the International Conference on Educational, Cultural and Disability. This is them preparing their presentation, and they presented at Hope University with Professor Barden, and it was an international research presentation, international conference, which they never would have had the chance to take part in at all. So I think that's nearly my final. Yes, the answer to that question was yes. So this is again just to sum up the comments that people had, and if you could go on to the next slide. And if you know of anybody who would like to be referred to our services, we work closely with MenCap as well. We have a lot of people from MenCap coming along. People often don't know what there is to know and what they need to, what opportunities are available. Please get in touch with me. This is only a minor 1-minute summary in 10 minutes. I've been able to try and express the experiences that people have when they come, because we are all about people. And that's what our organisation, we're not a day centre, we're not something that does things to people. We're a safe place for people to come and meet, to feel supported and to be able to have their voices heard. Thank you very much for listening, and I'm happy to stay on if anybody would like to take any questions or comments later. Thank you.
If everyone just uses the chat facility, please, and Janet will do that. Our next speaker is a public advisor called Jamie. Jamie, are you there?
Yeah.
And I will just share the screen. Okay, Jamie.
Okay, thank you, Naheed. I was appointed as a clerk at North West Coast, which is now ARC North West Coast Public Advisor in 2018 to evaluate the benefits gained from service users with neurodiverse conditions using a social prescribing service based in Merseyside in the coastal town of Southport and the coastal city of Liverpool. I've continued to be a public advisor on various different health research projects, as well as my physical ailments of having one functioning lung, kyphoscoliosis and Grant-Chanter left pain syndrome. I also have hidden disabilities which may not be as noticeable. I have neurodiverse conditions like Asperger's syndrome and dyspraxia, which causes the onset of depression and anxiety, causing challenging obstacles within my life. In August 1993, I was diagnosed with dyspraxia at age 4, and the symptoms still affect me now as an adult in terms of speech and language. There are occasions when I have difficulty organizing the sequence and content of my language, resulting in repeating myself, which people have noticed. My speech can also sometimes be unclear with difficulty pronouncing some words. I did have speech therapy when I was younger, and I've noticed from recording my voice on a dictaphone that my speech can be unclear at times. Perception is another issue. I have loose sense of time, speed, distance, and weight, causing difficulties cooking. Emotions and behaviors are an issue. I tend to get stressed, depressed, and anxious very easily, and I have problems picking up non-verbal signals or judging tones, the pitch of my voice and of others, which can lead me to taking things literally and causing difficulty in understanding and listening. I have problems with gross motor coordination skills such as poor posture, also caused by my kyphoscoliosis and weak muscle tone, and poor hand and eye coordination, which is why I don't drive. I also have an inadequate grasp when it comes to using locks and keys, tools, and domestic appliances. I would personally say that dyspraxia affects mostly my learning, thought, and memory processing skills. This includes difficulty in following and remembering instructions, especially more than one at a time. Occasionally difficulty concentrating, depending on the task. I am slow finishing a task, which this includes difficulty in following and remembering instructions, especially more than one at a time. Occasionally difficulty concentrating depending on the task. I'm slow finishing tasks, may do one task at a time properly or try to do many things at once when anxious. Poor short-term memory and poor sequencing causes problems with maths, resulting in dyscalculia. This has caused difficulty in making sense of money and estimating and recognizing quantities without counting. Difficulty with mental maths, problem solving, poor visual and spatial orientation, problems telling the time on an analog clock, and problems of differentiating left and right directions. After experiencing a breakdown of depression and high anxiety in November 2016, at 27 years old, I was diagnosed with Asperger's syndrome. A report was conducted by an Asperger's team diagnostician at NHS Merseycare. The results found that I had social impairment. I find it difficult to make friends, terrible at communicating with large groups of friends, as I prefer one-to-one communication. I love gaming and tend to have a fascination with train routes, A roads and motorways, postcodes and counties and repetitive routines. Yes, I do like following a set pattern. For example, I need to attend my Catholic church either Wednesday or Saturday night each week, otherwise the week will go bad for me. I have speech and language problems and non-verbal communication and motor clumsiness since birth. As a public advisor, I'm also very committed to helping my friend Hazel, based in the coastal town of Southport, Merseyside. She has a chronic health condition that affects the central nervous system known as fibromyalgia and ME. Myalgic encephalitis, aka chronic fatigue syndrome, which has similar common symptoms to my neurodiverse condition of dyspraxia, dyscalculia, and Asperger's syndrome, which are all three interlinked. I would like Nahi to share with you all now a short extract from my friend Hazel Long about how her neurodiverse condition of ME and fibromyalgia affects her.
Thank you, Jamie. On behalf of Jamie's friend, many people with chronic illnesses such as fibromyalgia and ME regularly experience cognitive impairment that is commonly called brain fog and can have similar effects on the brain to autism. The severity varies from person to person. For me, I have some degree of it all the time since getting ME. When I am unwell or more exhausted than usual, it is often worse. It has strongly affected my interactions with doctors. My brain works more slowly than it used to, and when questions are fired at me at speed, as they often are, I get confused and say things that are not correct or fail to say something important. Short-term memory can also be impacted, and I often find I cannot remember what the doctor has said. So if given time to take notes or have a note taker present with me, that is really useful. It is often best for me to prepare something in writing in advance of an appointment at moments when I am have more mental clarity. And while some doctors are happy to read a short description of my issue, others are very unwilling, which is a shame because that is how I can best communicate the problem. When doctors are impatient with me, or when I feel I have not had the chance to communicate my medical issue accurately, I often feel very demoralized for several days and frustrated with my condition and lack of awareness of its effects. I feel that doctors often make assumptions and I do not get the chance to give my point of view. In summary, I would love to see more awareness of the neurological effects of common chronic illnesses and more tolerance of its impacts on communication and memory. A final word from you, Jamie.
If there's anything I would like you all to take away and remember throughout this seldom heard forum on neurodiverse conditions, is that hidden disabilities should no longer be overlooked by health professionals. Neurodiverse health conditions are as vitally important as physical health conditions, as mental health is interlinked with physical health. And this is especially evident with fibromyalgia and ME. I personally do not feel that health professionals truly understand the working of the brain, and more research needs to be funded into understanding and managing neurodiverse conditions.
Thank you, Jamie. That was really nice. If you can go on to our next speaker, please, Paul Davenport. Sorry to rush everyone, but we're trying to just make sure everyone gets their bit in.
Hello.
Thank you, Paul.
Sure. Rightio, I'll just share my slides. Okay. Right, hello, hi, my name's Paul Davenport and I am the ASC advisory teacher for Knowsley. It's my job to go out into primary and secondary schools in the Knowsley region to offer advice to the teaching staff there if there's a student who's got autism or on the ND pathway. I've spent 20 years working in special educational needs schools, 14 years spent in a school for children with a primary diagnosis of autism in South Liverpool. And what I'm just going to talk about here is just some of the experiences I've had in trying to raise autism awareness in organisations to help students with autism and their parents when it comes time for them to move on into the world of work at the end, and some of the successes which we had. So just to start with, I know that there's lots of people here who've commented that they know all about autism, but I didn't want to fall into the trap of assuming everyone knows about it. So I'm just going to do a very brief summary, just to say autism is a spectrum condition. No two people with autism are the same, and it affects 1 in 100 people. It's roughly 700,000 people in the country. There may be a lot more people with autism who are undiagnosed. Certainly girls are at a ratio of 1 to 3 to boys with autism, but girls mask, so there may be more girls with autism out there. Autism is commonly known as ASD, autistic spectrum disorder, or autistic spectrum condition, which is used in Knowsley, just because people prefer to use condition instead of disorder. It's a lifelong condition. There is no cure. I have had parents in the past ask me, when their child is going to get better. And I've had to explain that, this is a lifelong condition, and that it's something which they will learn to manage as they get older. Only 21.7% of adults with autism are in full or part-time employment. And this is part of the reason why I worked as part of my job when I was head of post-16 to help students get out into the world of work. And it's a big thing for parents because they want to see their child succeed, and they want to see them to develop and get more independence. So what counts as a diagnosis of autism are difficulties with social communication, repetitive thought processes, and sensory needs. And those with autism often have other conditions such as dyslexia, ADHD, or learning disabilities. And the school I used to work at, it was roughly about 60% of the children there had learning disabilities. Around, I think it was about 40% had dyslexia, just to show there. So whizzing on to the next slide. Key features are social communication issues, so problems interpreting verbal and non-verbal language. Certainly when you're looking at the world of work, if people use idiomatic speech phrases. I was speaking to a gentleman the other day who said, oh, when the students come in, I'll walk them through it. And I thought, well, someone with autism might well say, walk them through what? Also, when you're giving out instructions, sometimes people will voice them as a question rather than an instruction. So it might be, would you like to sit down? And they might say no. Or would you like to take a seat? And again, taking a seat is taking a seat where? Difficulties in social interaction and identifying emotions and making friendships, reading between the lines in conversations, links into flexibility of thought and the theory of mind and problem solving. I have a student who found it very difficult to cross the road because you'd say, cross when there are no cars coming. Well, sometimes waiting for no cars to come, even if there's one very, very far away in the distance, can take a long time. Processing delay, again, they often say if you're giving instructions to leave a 7-second delay between you saying something to allow time to process. And it's when people overload those instructions or people overload things they're saying, including sensory issues as well, can really cause problems in being able to think about what you're being asked to do, which then leads into why repetitive routines can be such an important thing, because if you have processing delay, you'd like things to stay the same so you don't have to keep on processing new situations. So by having a repetitive routine, you're going to find that it's something which you know what you're going to be doing. Sensory over or under sensitivity, again, is a big thing that affects all stuff there. Demand avoidance, again, is if someone is having issues where often it can be linked to anxiety, and if demand is being placed on someone, they don't wish to get something wrong, so they will refuse to do it. And it's about how you speak to them, how you word instructions, how you go around those. Anxiety, as I mentioned before, links to all of that. And then special interests, obsessions, Doctor Who, washing machines, other things. I have many students who've been involved in those. So there's my quick run through. I'm not a medical professional, I am a teacher. So apologies if anyone thinks it's a bit basic. So when I've dealt with parents, one of the things we've always said to them is, what do you want for your child? And these are the key 3 things I've always found. It's been happiness, it's been safety, and it's been a chance to achieve. And it's what the students also generally tend to want. They certainly want to be happy, they like to be safe. But again, if they've got the ability, they're able to achieve something, I think it's very important that they do. And when we talk through with parents and the students, we talk about what's achievable, what's capable for them to do. And what I found through talking to them was a lot of them were very, very interested in digital media. And they were very interested in computer games. They were very, very interested in art. And so to that end, I engaged an enterprise advisor in the school I was working at. And the enterprise advisor, who had a son who's got Asperger's, suggested that we get involved in a competition called the Beamer Digital Day. That's the British Interactive Media Association, which we did for 3 years. And we had our biggest success in 2018, which I'm going to go on to now. Now, Beamer Digital Day is a national competition for schools across the country in which they have to come up with digital solutions to problems. Now, the 3 challenges in 2018 was one from the BBC, the FA, and Vodafone. Now, we were very lucky in that we had 3 of our entries got through to the finals, 1 for the FA and 2 for Vodafone. And in fact, one of the team's entries won the Vodafone challenge. And what was important in that, certainly for me, was that the judging panel had no idea that the entry was from a group of neurodiverse children who had autism at all. And in fact, they beat a top grammar school from down south, which was quite enjoyable when I found that out. And it just showed that they were judged truly on their merits. Now, the school was the first SEND school in the country to win, and it's the first school from Liverpool, so we've got a double first there. And what the students had to do was they had to design an app. Vodafone, they wanted to find a way to make shopping more attractive to those who might find it difficult to get out. And certainly that tapped into some of our students' lived-in experiences. And so they designed an app which would contain a virtual high street and a game in which people could play. And Vodafone thought it was wonderful. Now, as part of the winning of the competition, we got to go down to Vodafone headquarters in London, and the students took part in some activities. And if I move on to the next slide, this is what happened there. They took part in the day, and as you can see there, the head of digital experience there found he was blown away with what happened. As they said, the unfiltered nature of the ideas and the creativity, because a lot of the students, they just didn't think about what they were saying in terms of social constraints. They would just sort of say, this would be a great idea. Why don't you try this? Why don't you do this? And they were coming at it from a completely different perspective. And as you said there, during one session, the students came up with 45 ideas in 5 minutes. They covered an entire wall in Post-it notes, and they could not believe it. They said they've never met people with autism before, and they love to work with them again, because, as they said, the students came up with ideas they never would have thought of. And I think that's a very important thing when you're looking at the workplace, that people with autism have such an untapped resource out there. And if companies could find a way to make themselves more attractive, there was a whole load of more ideas and creativity which could be utilized. So how did this help our students? Well, it expanded the potential. It expanded what they thought was possible. The students said that they didn't think, there were things there which they didn't think they could do, which now they thought they could, because they'd seen some of these things. They'd seen what was involved. And if you mentioned digital media, a lot of them just thought it was like using computers, but this was completely different. It was lots of different applications for the students. And they thought that, as they say, there's lots of jobs I could do that I didn't think were possible. And parents were saying that it's broadened the horizons for the child. We got in digital companies in to use a Oculus Rift, and the students were using some new technology there. They were going out into design agencies and using some of the, going out and visiting places. And it really expanded the options for them, which was really good. So how can people help, organizations help? First thing would be to raise awareness of autism within an organisation. Now, Knowsley and Liverpool Council do a joint autism awareness training. It's 1 hour long for organisations, and it's about ASC, learning disabilities and learning difficulties, which lots of companies are now going on to raise awareness. It's also about saying you're going to make a cultural change to employ people with autism. Knowsley do have a empowered job carving scheme to give people with autism and learning difficulties a chance for paid employment within companies. As I stated before, learn about autism as much as you can, so you're more well versed in it, and also contact your local SEND school and see if there's something for organisations that they can do to get involved, because those are the people, there's the untapped potential there. So what can workplaces do? Top tips. Certainly when you're inducting staff, have an illustrated transition booklet with pictures of rooms and the staff there. Have transition visits so the person can get in there. They can have several visits so they can see where they're going to work. Include a map to work, including bus and train routes. A map of work, potentially colour-coded areas, both on the map and in work, can then help that person find out where they're going, for example, the canteen or their workstation, or other areas, the toilets. It can be a lot easier for them to follow. And then also, if possible, a timetable, if that's something you can do of the working day. So again, you're preparing in advance what they can do. So they've got that little bit of structure there. What can we do in the workplace for effective communication? Give clear and concise instructions. Don't give too many at once. As I mentioned before about processing delay, if you give the clear instructions, check that the person knows what you have, that they know what you've said to them, and get them to repeat back, because sometimes they might just say, yeah, I understand, and they don't. Chunking the tasks down, which you're going to have. which you're going to give. You can always give them more tasks afterwards. As I said, check the employee understands what you want and state the result you want and why they're doing it, and give regular feedback there. Give time to listen to questions from the employee, because they may well have lots of questions to fully understand. Assume nothing. Explain the unwritten rules, cultures and protocols within your organisation. As I stated before, avoid idiomatic speech, because that may well be quite confusing if someone takes things quite literally. Socially, behaviourally, ask permission before you tell everyone that an employee is autistic, because they might not want people to know. It's quite simple. Be consistent.
Paul, you've just got 1 minute left.
1 minute left, okay. Be consistent with what you do when you say your procedures. Be patient, because people with autism can be perfectionists. They could take longer to process information, or they might not have understood what you've asked them to do. You know, they can be very diligent and get on with lots of tasks there. Be aware of social differences. Responding questions could be said quite bluntly or literally, but they're not being rude. That's just responding to a question. Also, non-attendance at socialising events in work isn't because they're rude. It's just they might find that very difficult. Look for triggers for stress and act proactively. And if there's a work buddy they could talk to, try and provide one of those. Environmentally, be consistent with the desk or work area. Avoid changes to routine. Know your employee and their sensory issues, such as do they need a quiet area or earbuds they could use, and avoid clutter on walls around focal points, because it can be a distraction. Why should you have the neurodiverse workforce? Well, it gives you new perspectives. Elon Musk has said that he's got autism, and look what he's achieved. Diligence in tasks, I mentioned. You can get a competitive edge, and it's reputation enhancing, and it's morally enriching, and it's just the right thing to do. I mentioned before, research opportunities, I think, really. How many staff in organisations are autistic? How many staff have not disclosed their autism and why? What changes, both culturally and environmentally, have organisations made to be more inclusive to people with autism? And how autism aware are staff, and how many could be potentially undiagnosed? Thank you very much.
That was great, Paul. A really interesting presentation, that, especially for people in the workplace. If you can just have a look at the chat, if everyone can direct their questions to the chat. Hopefully we'll have a couple of minutes at the end. If we can have our next speaker ready, please, which is Steph. I'll just share the screen. And Steph is actually a public advisor with ARC North West Coast. And this is, Steph is going to introduce her son. So if you just let me know when to change slides, Steph, thank you.
Okay, first, hello, my name's Steph Tomlinson. I am a public advisor, a mum to Elliot in the picture, and community activist within Knowsley, Stockbridge Village in Knowsley. Next slide, please. My son is 20, being educated in Liverpool, in Knowsley. Wonderful education, I've always had good support. I've actually prepared a speech for today, but I'm not going to do that to everyone's hard work, especially Naheed. Thank you. Elliot was born in London, a millennium baby, and was very slow to develop. So he had developmental delays early 18 months, and we've seen our first paediatrician in London. And then 2.5, we decided to up sticks and move to Knowsley. But before that, we lived in a lovely part of London. I lived there with my partner, who was Italian, and this new service come about called Sure Start. So, but we lived on the other side of the road. The other side of the road was actually accessible to Sure Start, but we weren't. So I did try and pursue Sure Start nurseries, placements, but I was unable to due to the postcode. So we decided to up sticks and move back to Knowsley. I was born in Knowsley, educated in Knowsley, so we moved to Stockbridge Village, where I was brought up. Elliot was diagnosed with dyspraxia at 3 and went to a mainstream nursery with a statement of educational special needs at the age of 3.5, and with a one-to-one that was given to him. Elliot had a double placement in nursery, which was repeated, the same routine was repeated in the morning and in the afternoon to get him to be a bit more aware. Next slide, please. This is Elliot moving forward. He was diagnosed with autism at 9. He stims, he flaps. He's an extremely anxious young man. He's bright, funny, articulate. He's been educated in mainstream till the age of 16, achieving GCSEs. He's got aspirations for the future, but he's also, his life needs to be ruled by a regimented way for him to be able to feel safe. He's very socially impaired. Society is a struggle for him. And his anxieties often rule his life. He needs reassurance that life is okay. It's reassurance that he will be okay. The decisions he makes, are they okay? Are they the right decision? So in our community, and Knowsley is a deprived borough of the Northwest. So we have a program called the Community Ambassador Program, and Elliot is an ambassador and a mentor to the youth on our estate, with Vibe, which is a youth provision within Knowsley. And he chats with the younger people, and he goes out and does surveys and online, and asks them what do they want out of our estate, what's missing, what needs to be improved. He is a fabulous young man. Next slide. We took part in Clark, Northwest Coast, in a neighbourhood resilience programme, part of Corran, and Elliot's story actually features in this. And this is our road show, which was in our local library, and there's Elliot telling his story in what it's like to be a young person in society today with health inequalities. He has good plan. He's at a local college doing health and social care, and he goes hoping with good results to go back in September to complete another year. We've had good support from Knowsley and good support from specific autism, or the autism specialist teachers have really helped him. It's given Elliot a voice to be able to air his concerns and ensure that the school listen to his concerns and adapt and adopt new ways of supporting Elliot within the classroom. Public advisor, I challenge the community. I'm part of a really close-knit community and community activist, and I try and support hard-to-reach groups such as people with disabilities, elderly and mental health. I became a member of Clark, now ARC, 7 years ago, and I've took part in several aspects of research. And for me, Clark is a real eye-opener. It's also a real thing that I do for me and my community. It gives us an opportunity to work side by side with researchers, with academics, and also with other members of the community from other areas of the Northwest Coast, which is really important for us to be able to broker relationship, strengthen connections, and also work collaboratively to co-produce pieces of research that have been produced side by side with the public. And that's me, that's my story.
Thank you for that, Steph. I'm now going to, I had the opportunity to interview Elliot, so I'm just going to play that for you. Hi, Elliot. Thanks for joining us on the Seldom Heard Forum. Would you like to tell me a little bit about yourself?
So I'm Elliot Greco. I'm 20. I know, don't look it, but and I'm a student at Knowsley College studying health and social care.
The topic of our Seldom Heard Forum today is about neurodiversity. Do you feel that you're treated differently because of your autism?
I'd say so, yeah, unfortunately, because ever since I got my diagnosis and understood that I was autistic, I started having a lot of people patronising me and treating me a bit like a child, and if that makes sense. So that has made me feel a bit like, how do I put it, like outside of the picture and not being part of the gang, even though people say I am. So it just makes me feel a bit weak, to be honest.
Yeah, I can understand that. So do you feel then that your autism has stopped you from having ambitions for the future?
I don't think so, but before I decided to focus on being a social worker, I did like loads of acting since I was 10 years old. And when it came to like later down the line during my GCSEs, like a lot of people believed I was good, like not for the love of it, but because they've seen me as a good actor. And a lot of people kept going, oh, you won't be up to this, or you won't handle this. And all it was basically was doing a performance, which I've done before. So it's like they didn't really understand me as much. So they didn't like know what my acting talent is in a sense. And I just didn't feel as believed in, to be honest.
No, is there anything about autism that you feel has made you unhappy?
I think autism is a bit of a barrier for me. Like I do, like as I said at the start, I do try to hide it, so I can get away from the patronism. But I think what makes me unhappy about being autistic would be, I'll say, like more treated differently and not being treated as a normal human being, really, and it's kind of like stopped me.
Hi Elliot, thanks for joining us on the Seldom.
Other conditions which I'd rather not go into because of my confidence, really, and me having the fear of somebody who I try to socialise with patronising me again.
I've noticed that you're a mentor and a community ambassador. So are you accepted freely then in the community in Stockbridge Village where you live?
I'd say so. Like when I started the ambassador program, it like even though like obviously I have me other conditions which I'd rather not go into, I really forced that would be taken into account, but in the wrong way. So when I told them that, they just continued to treat me as a volunteer. They didn't treat me as a child or anything. And even though I needed my help, they still made me feel in control, if you like. So when I was asked to do my voluntary work, they just let me do it, and without like being patronised or having them like on my tail on everything I do. So
do you think you're treated differently with autism?
I'd say I am, unfortunately, because I do, because this does link to like the patronism and people people saying, oh, Elliot's autistic, they're there, and that to me just like for a trans-year-old like myself, it kind of makes me feel a bit like I'm 5 when people do that. So
yeah, so it's like they're making presumptions without even having spoken to you. So do you think then that there is enough support there for young people with autism?
I don't. I think there's like a very small percentage. There has been like help with like keeping young people in provisions and that, but I think the main thing, and I think that's like a small percentage, like 5%, and the other like 90% is more like not many people like being able to help autistic people like break the chains, if that makes sense. So so obviously with autism there are some things I do which I can't control, but it's a question of trying to push it aside and to try and like block off that patronism and just not like bother with it and just carry on and just carry on being yourself, I suppose, because I think that is a very small percentage of the amount of people who treat autistic people as they are, and it's basically helping autistic people know what to do if they feel patronised and how they can come over that.
Oh, that's great. Do you feel that there are lessons people can learn from people like yourself who have autism? What is it? What message would you like to give our audience today?
To be honest, if I could give a message to people who listen to me today, is like, don't try not to like define people, because people could be different. It's like what's been going on social media most of the time. Like, people with disabilities could be in a wheelchair or have a walking stick or crutches, but there could be some people like myself who doesn't have any of that and just keeps roaming on. So and I think like posters on buildings and on social media, that to me isn't enough. It's a question of like sending that message out so they mean it. So they really think when they see someone who may do things they can't control, like breathe out the mouth or do some things like we wouldn't usually do. And it's a question of just saying, he may just have a disability. He may be just different to everyone else. He's still a human being. So it's a question of being aware that he may be autistic, but I know that the last thing he wants is people patronising him and treating him like he's younger than his age or treating him like he's weak. I just like to be known as Elliot, as a young man, I'd say.
Well, I'm sure everyone who's listening to you today is going to distinguish that you are a very young man, a very handsome young man as that. And I'm sure you do your mum very proud, and it's been absolutely wonderful to speak to you today. And I look forward to hearing more about what you're doing in Stockport Village in the future. Thank you very much, Elliot.
No problem.
Thank you for that, Steph, and that was brilliant, Elliot. If you can have some closing remarks from you, Shame, I think we've still got a couple of minutes.
Yeah, so I'd like to say thank you to everyone, our wonderful speakers with all the interesting points that they've highlighted, but most importantly as well to our public members who've shared their stories that provided really deep insight, and also our young advisors, our young people, Finn and Elliot. You know, it's beautiful to kind of finish off with Elliot's story, which is brilliant. So I would like to remind everyone that hopefully we will follow our session today with a blog. Please do check our website for that. We are also hoping to schedule a further discussion to discuss what we've discussed today. So we'll keep you posted in that regard. A short follow-up evaluation survey will be emailed to you just to make sure that we are building our approach in terms of this Seldom Head Forum. And then finally, just wanted to bring people's attention to our next forum that will be on the 20th of September. And the forum will focus on Gypsy, Travellers and Roma communities. I do apologize that we haven't had room enough for a panel discussion, but the chat function has been great. And if you have any firing questions, please do email us and we will be in touch with you. Thank you so much, everyone.